So thank you everyone for joining us. This is our Love in Action tribute to Mother's Day. This is a part of our World Health Day initiative to share stories, bring awareness, and raise critical funds for St. Damien Pediatric Hospital. Actually, St. Damien's anniversary, their 37th anniversary, landed on Mother's Day this year. So it seemed very fitting to not only celebrate the hospital, but also mothers in Haiti, because that is what it takes to get this work done, is everyone coming together. My name is Amy Miner, and I work for the St. Damien Pediatric Hospital Fund. I've been with NPH USA since 2023, but new to the role of working with the hospital since February of this year. My colleague Allison Donahue is joining me. She's going to help with the virtual program. She is on the East Coast and in the Boston office. And last but not least, we have Erin McNulty. She is part of our donor care and events team. She's helping with our tech today. Very important role, as you saw. Thank you, Erin, so much. I am glad that that is your role and not mine today. So thank you. Huge shout out to all the help we had to put this together. And with that, Allison, I'm going to have you jump in and start us off.
Thank you, Amy. NPH was founded in 1954 by Father William Wasson with a simple but powerful idea that no child should ever be abandoned, forgotten, or left to face life alone. What began as one child turned into one home and has now grown into a network of homes and programs serving children and families across 9 countries in Latin America and the Caribbean. NPH's entry into Haiti came when Father Wasson, joined by Father Rick Frechette, answered Mother Teresa's call to come and visit her hospice for mothers who were dying from HIV/AIDS. Moved by compassion and recognizing the tragic implications the crisis had on the children of these mothers, they founded a home for orphaned and abandoned children that became NPH Haiti. The mothers suffering were in their final moments, yet their biggest worry was about who would care for their children after they were gone. That heartbreak became the foundation of this work in Haiti. Having witnessed the tremendous burden of sickness and suffering that poverty imposed on both children and mothers, Father Wasson and Father Rick opened St. Damien Pediatric Hospital on May 10, 1989. Father Rick stayed in Haiti and provided spiritual guidance and empowerment to the Haitian community, and later completed his medical degree in order to also provide medical care for them. From the beginning, mothers have walked through those hospital doors carrying unimaginable fear, but also extraordinary courage. The hospital has evolved since 1989, as to explain for those of you who might be hearing about St. Damien for the first time. But we are a 75,000 square foot hospital that has 224 pediatric beds and maternal hospital serving vulnerable children and high-risk pregnant mothers in Haiti's capital. Our facility has an emergency room, surgery room, infectious disease wards, outpatient and dental clinics, public health, maternity, neonatology, oncology, and HIV programs. We are the only hospital in Haiti, which is a country of 11 million people, that provides pediatric oncology services. As Amy mentioned, ironically this year, St. Damien's 37th anniversary actually falls on Mother's Day. And as we reflected on that, it felt especially meaningful to center today around the power of mother's love. Not only the love shown by mothers fighting tirelessly for their children, but also the compassion and care shown every day by the St. Damien staff. So in preparation for this program, when we were talking with Dr. Jenny, she shared with us how the anniversary is typically celebrated at St. Damien. And so we wanted her to be able to share a few notes with you about that as well. So Dr. Jenny, do you want to share a little bit here?
Dr. Jenny, we can't quite hear
Still
you.
with us?
And I have you unmuted. If you can unmute on your end.
Okay, can you hear me now?
Yeah.
Yes.
Okay. Good morning, everyone. I'm happy to be here with you today. So, as Amy was saying, we typically celebrate Mother's Day, and but this time it was special because we celebrated Nurses Week, and it was St. Damien's 37th anniversary. And usually the staff, there's a choir and the staff participate. There's a real bond between resident, patient, and the staff. So the staff is part of the choir, and there are some patient part of the choir too. And we did have a mass on the 12th of May. And Father Week celebrate the mass with the choir, with the patient at the hospital chapel.
That's beautiful. It sounds like a nice celebration. So I think we're just going to pop back in and then we'll hear from Jenny, Dr. Jenny, a little bit more in a while. But so at St. Damien, the doctors, nurses, caregivers, and outreach teams care for each child with the same tenderness, protection, and devotion that a mother gives her own child. They celebrate victories, sit beside families in moments of fear, comfort grieving patients, and refuse to give up on children who need them. In many ways, patients gain an extended family throughout the care that they receive at the hospital. So now I'm going to turn it over to Amy, and she's going to talk a little bit more. Take it away, Amy.
All right. Thank you, Allison, and thank you, Dr. Jenny, for sharing those remarks. It's always fun to hear what's happening day to day at the hospital and in Haiti. So as Allison mentioned, it is really incredible and quite an accomplishment to have uninterrupted services in Haiti for 37 years, especially now as the country is dealing with some instability. Many of the hospitals have had to close their doors, but St. Damien has been able to remain open and operating. And through it all, mothers keep showing up and refusing to give up. So it's quite incredible. The hospital is there in some of life's most critical moments, and it's also there in joy-filled moments like the birth of a child. We recently had a story shared with us that in April, there was a mother that arrived at St. Damien seeking care, knew that she was carrying at least one child, didn't realize that she was carrying triplets. So she was rushed into an emergency C-section, and because of the skilled delivery team and the prepared neonatology department, all three babies were safely delivered, cared for in their first few moments of life, and now have all returned home with mom safely. So it's stories like that that remind us why this care is so important. Had that not been something where there was medical care available, the situation might have been a very different outcome. So we're happy that every safe delivery that we have, that every child that is sent home, every mother that's able to hold her baby is nothing short of a miracle. And we appreciate that. And sadly, those joyful moments are not guaranteed for many mothers and children. For every story of hope, there's countless families still facing overwhelming fear, barriers to care, and life-threatening conditions. Haiti has the highest rate of infant and maternal mortality in the Western Hemisphere. Nearly 1 in 19 children dies before their 5th birthday, largely of preventable diseases. And inadequate sanitation and widespread poverty have led to young children being 15 times more likely to die from diarrhea and pneumonia, which we take for granted as treatable issues, more than HIV and AIDS even. And 1 in 4 children is malnourished, with that number on the rise due to the instability currently there. Every one of these statistics is a mother who carried life and then was faced with unimaginable possibility of loss. And it's mothers who are making those impossible choices every day between food, medicine, and safety when there's never enough of any of them. As a mother myself, these staggering statistics really pull at my heartstrings and remind me how fragile life is and how important healthcare equity is. Dr. Jenny deeply understands the extreme challenges faced by patients and medical staff in Haiti. She served as the HIV/AIDS and Community Health Program Coordinator at St. Damien Pediatric Hospital for 8 years. She is a distinguished healthcare provider and researcher with expertise spanning pediatric care, community health programs, and medical research. She holds a medical degree from Notre Dame University in Haiti, a master's in public health from Quisqueya University, and certification in leadership and management from the University of Washington. Dr. Jenny also worked as a clinical liaison research specialist at the Harvard Brain Tissue Resource Center, where she analyzed medical records to identify disease prognostics and predictive factors. Currently, she works as a registered nurse at Salem Haven Skilled Nursing Facility and Rehabilitation Center, providing high-quality healthcare to residents and giving them the at-home feeling. Dr. Jenny has witnessed not only the medical crisis, but the emotional weight carried by mothers who arrive with nothing but hope and desperation. Dr. Jenny knows that if St. Damien ceased to exist, children would die. As a passionate advocate, she is here to share her firsthand accounts. So everyone please welcome Dr. Jenny Edouard.
Thank you, Amy. Once again, thank you everyone for welcoming me today. I'm honored to be here with you. Your generosity and willingness to help is very uplifting. Together, we can make it possible for St. Damien to continue providing life-saving care to children and families in desperate need. As a former coordinator of the HIV/AIDS and Community Health Program at St. Damien Pediatric Hospital from 2014 to 2022, it is an honor for me, even if miles away, to be able to talk to you and advocate for these innocent babies, children, mothers, and extraordinarily courageous staff members. The 500 employees of St. Damien risk their lives daily to care for sick and vulnerable children and mothers. In the midst of violence and instability, every day is high stake, not only medically, but personally. Staff members work long hours under extraordinary pressure, never knowing what challenges they may face, simply getting to and from the hospital. Staff bravely endures all this, wondering whether they will even have the resources they need to provide quality care. Right now, St. Damien urgently needs medication, medical supplies, equipment, staff support, and security resources to keep the hospital operating safely. St. Damien Pediatric Hospital provides over 50,000 services annually, including in and outpatient care, with approximately 3,000 hospitalizations done per year. Many patients have lost their housing, and it is very difficult to get food to take with the medication. Ongoing violence, transportation barriers, and supply shortages continue making it difficult for both patients and staff to access care safely. Food insecurity has become devastating. According to a recent ActionAid survey, 9 out of 10 people in Haiti go an entire day without food. St. Damien is now treating severe malnutrition throughout the hospital, especially among children. Treatment is intensive and long-term and depends upon the condition of the child. I would like to share with you a story that captures both the challenges families face in Haiti and the extraordinary strength of mothers fighting for their children. Suze Pierre, I changed the name in purpose to protect her identity, was a 20-month-old baby girl who was hospitalized and treated for 2 months at St. Damien for advanced AIDS with severe pneumonia and tuberculosis. She was starting on highly active antiretroviral therapy, and we trained the mother on how to provide special care and medication for the baby. But she missed follow-up appointments. Effort to support the family included providing transportation funds and a field agent to deliver medication. But still, Susie's mother did not return. After 2 months of absence, the team decided to pay a special visit to the family. The visit was a real adventure and an example of the above and beyond dedication of the team. We walked 4 hours from the last point, reached by car through the mountains. We realized that this is the trip the mother must make for every follow-up visit all the way while carrying the child. As you can see in the picture, this is a psychologist holding his bag because it was a wide trip climbing those mountains. Imagine the mother doing this trip carrying the child. So the family was very touched to see the whole team made up the psychologist, the pediatrician, the pharmacist, and the field agent coming to see why the baby girl was missing appointment. The team also saw firsthand the terrible economic situation of the girl and the difficulties her mother faced trying to keep Suze healthy. Despite a mother's love and care for her child, the resource-limited situation added barriers that no mother should have faced. Everyone came back more motivated to work harder at helping the families to improve their condition. Together, the medical team figured out a plan for helping the mom administer care and monitor Susie's health as best as we could. We kept in touch with the family, and unfortunately, the sister and the mother has passed. But because of her love and the care of the Saint Damien staff, Suze is now an adult. She's 23 years old, and she's a member of her adult cohort HIV staff. She has her own child now. She's a mother herself and very dedicated mother, and is still able to receive care and some supply from our outreach team, as well as a care for herself and her children if needed. Again, I share this story because it is a powerful reminder of what a mother love looks like in the face of impossible circumstances that will go above and beyond for their child. Contributions like yours do more than fund medical programs. They help mothers keep fighting for their children. Your support provides care, nourishment, medicine, and hope to families who are doing everything they can to survive and protect the one they love most. This story took place in 2016 when I was still back in Haiti, but imagine how much harder life is for mothers and children today in 2026. With the country's ongoing crisis, poverty has become even more severe and heartbreaking. Hunger is widespread. Mothers are facing impossible choices every single day: how to feed their children, how to get them medical care, and how to keep them safe in the midst of violence and instability. And yet, despite these overwhelming challenges, mothers continue to show extraordinary strength and resilience. They work for hours carrying sick children in their arms. They sacrifice their own needs so their children can eat. They refuse to give up hope, even when resources are scarce and the future feels uncertain. Saint Damien staff work tirelessly to provide high-quality, compassionate care to every child and mother who walks through their doors, but they cannot do it alone. Today, only about 2 out of every 5 hospitals in Haiti remain operational, and all depends heavily on international aid to continue serving patients. The loss of critical support like USAID funding for hospital, emergency care, and mobile health clinic could have devastating consequences. More mothers, babies, and children may lose access to life-saving care and face preventable illness, complications, and death, especially those battling HIV/AIDS or cancer. But Haitian mothers, families, and healthcare workers continue standing firm with remarkable courage and determination. For 37 years, Saint Damien has remained a place of hope, healing, and dignity for vulnerable children and mothers. The hospital has learned how to stretch every resources and make it even the smallest support go a long, long way. Now, more than ever, mothers in Haiti need people willing to stand beside them. They need partners who believe that every mother deserves the chance to watch her child grow up healthy and safe. Together, through compassion and action, we can help ensure that mothers and children are not fighting this battle alone. We are delighted that you are here today, and we thank you for your compassion and generosity. At Saint Damien, dignity, respect, and hope are at the core of every treatment. Without Saint Damien, thousands of children and expectant mothers would have no place to go for quality medical care. Together, we can make the impossible possible. We can save children's lives in Haiti. Again, I really thank you all for your generosity and kindness and for being here today.
Thank you so much, Dr. Jenny, for sharing this powerful and impactful story. I know most of us are on mute, but we applaud you for sharing and for joining us today, and the work that you did while in Haiti and the work you do now. It's incredible. Not only is this story about a mother's love and support of her child, but how the love from the St. Damien staff, their dedication to walk 4 hours up a mountain to care for this child. It's really extraordinary how much of a family that St. Damien is for their patients and for one another to provide support. Dr. Gassant, the hospital's medical director, shared a message that I thought was so fitting for this story. And as we're celebrating World Health Day, despite these extreme challenges, we persevere. Our doctors, nurses, and support staff risk everything to care for the sick and the vulnerable because we truly believe every life deserves dignity and compassion. Hope is what fuels us. Hope gives us life, and your support not only funds our work, but it sends the message that we are not alone. We are not facing grave challenges alone. That partnership with all of you in support of the hospital creates that hope. It's true that if we could not do this or provide that hope without the support of our amazing network. So thank you so much for being here. And for anyone who's already supported our World Health Day efforts in this critical care, thank you so much. We are still currently about $44,000 away from our World Health Day goal that we need to keep the hospital and these programs active. So if you haven't yet supported this initiative or feel inspired to give again, we greatly appreciate your partnership to make this happen. Any donation, as Dr. Jenny said, it's hope, it's a gift. Dr. Gassant shares that same sentiment. With your generosity, we can continue to create these programs in life-saving medical care. So thank you. Dr. Jenny, any last comments, any last things you'd like to share before we wrap?
So once again, I want to thank everyone for jumping in today. And I was very honored and glad to share the little stories of St. Damien and Suze with you. And know that your contribution, your compassion and generosity go a long, long, long way. And the family always appreciate everything we're doing for them. It's really a great bond when you can see like people like Suze, her babies, those children like grow up with us, and some of our HIV children are now doctors too, nurses. There's a long way, and they are peer educator with us. So a lot of them stay with us after care. They're part of our adult cohort, but also they jump in, they go to the community, they spread awareness. So it's really not only a one-time thing, it's a long, you're contributing to a long life living situation. So thank you again for everything you've done so far, and you will keep doing for the children of St. Damien and mothers.
Thank you, Dr. Jenny. We greatly appreciate it. And thank you to everyone that joined us today. It was great having you. I hope you have a wonderful rest of your day.